Okay, so we're assuming that the person. Okay, good morning. Good morning, everybody. I'm going to jump in after the member has Medicaid and has tried to get home care, but finds that it's not enough. This is where I come into the picture. I work at attending home care. Um, we have a program that we're approved for. It's called NHTD, Nursing Home Transition and Diversion. The typical person that gets into NHTD, nursing home transition diversion, is somebody that has their Medicaid, is receiving some home care, but is not receiving enough. Typically, Medicaid, what I call traditional managed Medicaid, is not going to give people 24 hours of home care. However, if they meet certain criteria, then they can apply for the NHTD program. The NHTD program will give many, many more hours than an MLTC, managed long-term care. Medicaid will allow people. The criteria are very straightforward, very simple. The person has to, A, have active Medicaid. B, they have to present with some kind of cognitive decline. So I'm guessing that most of the caregivers that we're getting through PSS, their family member does have dementia, Alzheimer's. It doesn't even have to be a formal diagnosis, but there does have to be memory deficits, and that's documented by a doctor's letter. So the people that come to me need more hours. The regional office runs this whole program. The regional offices, they have the contract from the Department of Health to oversee this whole NHTD program. Attending home care is one of many providers. Not every home care agency is approved to do this NHTD program, but many are. Okay, so how do we start? I'm going to get you from point A to point B. Okay, the first point is a family member will call me and say, my mother only has 8 hours of home care. She's not safe alone. She has dementia. She forgets to take her medicine. Perhaps she's a wanderer. Perhaps she walked out of her house, forgot how to get home. Okay, that's the typical NHTD applicant. Well, I cannot just submit an application. So what I will do is I will guide the family member on who to call in order to refer their mother. So for example, they're calling the RRDC, Regional Resource Development Center. The family member has to call the RRDC and say, hey, I heard about this great program and I'd like to apply for my mother. That's step number one. Meanwhile, I cannot start the application. I cannot do anything. We're waiting. I want to be very honest and very realistic with everybody. Until you have that appointment scheduled with the RRDC, the Regional Resource Development Center, it could easily be a month. And that means that I cannot start the application. Okay? A month or so goes by, the family member calls me and says, hey, Rene, we have the interview scheduled with the regional office for people now are getting scheduled in April, believe it or not. So we wait. The intake is it's a fairly straightforward 15, 20-minute phone call. It takes place with somebody from the Regional Resource Development Center. Now, they're not deciding whether to approve 24 hours of home care for your mom or 12 hours if that's what the family is asking for. They're just deciding if your mom or your dad meets the protocol to apply for the NHTD program, okay? So the family is going to have a conversation with the regional office. The regional office is going to say, yes, your mom meets the criteria. Now, please go find an agency that can do the application. And that's where I come into the picture. Okay? I like to give people a time frame so that they, they're not disappointed and they're not sort of thinking that they, fell between the cracks. You're probably going to wait a good 6 weeks to get that intake. You have the intake, they send you a bunch of forms. There's nothing financial. If this is fully covered by Medicaid, the family member signs all the forms, returns it to our regional office person who sent it to them, and then has to choose an agency. So at that point, they could say, I want to work with Rene at Attending Home Care. They could choose any agency they want. Okay. And this is when the clock starts ticking. We do the application blank. It's like 25 pages. By the time we're done with that application, the whole package, it has a doctor's letter, it has my nurse's assessment. By the time we are finished with that application, you're looking at a package of close to 50 or sometimes even 60 pages. So we do that. That's not on the family to do. There's a lot of moving pieces. There's a nurse's assessment. There's a doctor's letter. There's my team does the application. We submit the application. Technically, we have 60 days to submit the application. We never ever wait 60 days. My feeling is that the family has already waited so long to have that intake phone call, you know, allowing them to apply for the program. I'm not going to make people wait 60 days to submit the application. The application goes in. Let me backtrack. There's one very important thing that I need everybody to do. As soon as you decide that you want to apply for NHTD, if you're already receiving services for managed long-term companies, Centers, VNS, Fidelis, if mom's already getting a few hours of home care, immediately ask them for more hours, okay? If Fidelis is giving your mom or your dad 8 hours of home care a day, but you need and you want 24, ask Fidelis for the 24 hours. Now, they will probably deny it, but when we submit the application for NHTD, we need to show the state that you have exhausted all other options, that you've begged and you've pleaded with Aetna or Fidelis or Centers or any of these companies, and they're not giving you what you want. So when I do the application, there's a question on there asking me if you've exhausted all other options. So I need to be able to show that you truly have exhausted the other options, mainly asking for the current managed Medicaid company to give you more hours. So that's something, it's never too soon to start doing that. I'm assuming that I'm speaking to you now as people whose mothers and fathers are already receiving some services through Medicaid. It's never too soon to start asking them, beg, plead, ask them for more hours. Don't be disappointed, they won't give you more hours, but that's something that we're going to need down the road, proof that you've at least tried that option, okay? We submit the application. The regional office has 14 days to look at the application. They usually take longer. They're very bombarded now. And then the application comes back to us. Sometimes they'll ask me to justify something a little better. Sometimes they'll ask me to elaborate a little more. But my applications are pretty much approved first time around. And then if you were to get approved for NHTD, what would happen was on the 30th of the month, your mother's getting her 6 or 8 hours of home care through traditional Medicaid. And then the first of the next month, like the next day, you'll be going into most likely 24 hours of HHA. So there's no gaps where there's no services. Okay, I'm just going to stop now before I go on, and I'm going to ask if anybody wants to ask a question at this point, since I don't see any questions on the chat. So unless anyone has any questions, I'm going to go on, okay? Okay, so what does NHTD, nursing home transition diversion, mean? It means we're transitioning somebody out of a nursing home, and the way to do it safely is with the NHTD program by giving them a lot of hours of home care. The diversion part of it means that the person is being diverted from ever having to go into a nursing home. And the way that's accomplished is by keeping them safe, most often with 24 hours of ease, okay? So we have the transition coming out of a nursing home. We have the diversion, preventing them from having to go into a home. Now, what about people that don't have Medicaid? We cannot apply for this service. So that's where we reach out to Ed Fridman, who can help with the Medicaid application. We reach out to PSS. Perhaps they can give some respites, a few hours, a couple of days a week, right, Madge? It's usually a couple of days a week. It's not it's not a permanent solution, but it's something to hold you over for the families that do not have Medicaid, okay? I am a poster child for Medicaid app. I encourage everybody to apply for Medicaid. Don't wait until you need it. And then I think Ed is going to just go over again that you could set up the trust, but not really have to start using it. Ed, if you could just jump in. Because a question I get asked often is, well, we don't need home care now. We really don't need anything. But if your mother or your father is 80 years old, you know, God willing, they're going to live still more years and they are going to need help. So I constantly see people who are panicking, and Ed can tell you more about that at the last minute. It doesn't work that way. So Ed, you're going to jump in, okay?
Sure. So yeah, I definitely recommend if, you know, everything, of course, with the government, with bureaucracy takes time. It's a process. So a Medicaid application will typically take 4 to 6 weeks. Then, you know, your loved one still has to get evaluated. So we're looking at a minimum of 2 to 3 months before somebody can even enroll in an MLTC from the time they apply. So definitely recommend if you see your parent, your loved one, yourself starting to deteriorate a little bit. Definitely do not wait to apply for Medicaid. It's a lengthy process. The sooner you submit it, the better it is. This way, you don't have to wait around when you do need the services for an application to be processed. There's no real harm in doing it. And like Rene mentioned, you don't have to, you can apply for Medicaid, get Medicaid. You don't have to accept services. You don't have to start funding a pool trust, but you can have it in place. This way, if you do need services, it's ready to go, and you don't have to start from point A. You'll already be ahead of the game. I'll be honest, 95 to 99% of our clients come to us when they're already in desperate need of help, and they want everything rushed. But of course, every one of our clients does that. So, and Medicaid is inundated with applications. So unfortunately, they cannot really rush too many applications. So can't stress enough, get ahead of the game, start the planning sooner rather than later. It's better to have it in place and not need it than need it and not have it in place. Especially now, since they may implement a 2.5-year look back period at some point for community Medicaid for the transfer of assets. Hasn't been implemented yet, and we're being told informally that the earliest that might go into effect is January 2025. So now is a great time to do the planning, to do the Medicaid application, get everything in. This way, if services are needed, everything's in place and you can move forward. Because at some point it's going to be more difficult to get Medicaid, and you don't want to wait around for services when you need it.
Right. And just to add to that, you cannot apply for NHTD if you don't have active Medicaid in real time. So you can't tell the regional office, well, Ed Fridman is working on my mom's Medicaid application now, and by the time I get to the intake and by the time Rene does the application, trust me, my mom will have Medicaid. They won't even do an intake. They won't even accept the referral if you don't have active Medicaid at the moment. So that's why I say I'm a poster child for Medicaid, because I've seen over the years too many families who don't prepare, and you'll get a little help from PSS, but it's not a long-term solution. It's not, forever. And I've seen too many families literally clean out their life savings on home care once their parents need somebody in the house. So yeah. Anyway, getting back to NHTD, you have the Medicaid, you've called the regional office, I'll give you their number. You've done everything you're supposed to do. You choose an agency, we've done the application, we submitted. What exactly is that parent member? Let's say we're going to say mom. What exactly is mom going to get from NHTD? Okay, so first of all, she will get a case manager. Now, if your mom's getting services now through traditional Medicaid, MLTC, managed long-term care, she does have a case manager. However, the case managers at the long-term Medicaid, the MLTCs, most of them have well over 100 cases on their caseload. With NHTD, you're going to get a service coordinator, one of my staff, a case manager, we call it service coordinator. You're going to get a service coordinator who's not allowed to have more than 25 cases. So when I tell you that it's very, very hands-on, intense case management, it doesn't, it's not hard to understand. My case manager by law was not allowed to have more than 25 cases. That means that if your mom sneezes and runs out of Kleenex, my case manager will make sure that there's Kleenex coming to your door the next day. But seriously, it's intense case management. If you feel that she could benefit from physical therapy at home, my case manager will arrange for it. If she needs transportation to get to a doctor's office with her aide, we will arrange for that. If she needs incontinence supplies, chalks, pull-ups, that's something that the family shouldn't have to do case management. That's what the NHTD program is giving them. In addition to that, you're getting the aides. So most of my cases, when they live alone and they present with memory deficits, do get 24 hours. Now, the beauty of the 24 hours in the NHTD program is, first of all, it's very unlikely that you'll get 24 hours of home care through managed Medicaid. The beauty of getting it through the NHTD program is that it comes in the form of a split shift. So a split shift means the aide comes for 12 hours and goes home. The next aide comes for 12 hours and goes home. These aides are not allowed to sleep. The whole purpose of NHTD is to provide the member with oversight and supervision, which means in order to supervise somebody, you've got to be awake. So anyone that's in NHTD that gets 24 hours, it is a split shift. I don't see a lot of split shifts now. I don't see a lot of split shifts with managed long-term care Medicaid. Every now and then I do see what's called a live-in, which is not really suitable for most patients with dementia, because most patients with dementia, many wake up in the middle of the night, are confused, maybe get a little scared, maybe get confused about, is it day, is it night, am I supposed to take my medicine or not? So in NHTD, if you're approved for the 24 hours, it's going to be a split shift. If you're lucky and you can get the 24 hours through MLTC, it's most likely going to be a live-in, which means the aides sleep. They have to have 5 hours of uninterrupted sleep at night. So that's the whole difference in the way the aides come. Number one, it's the amount of hours, and number two, the way the hours are broken up. So if there's an aide in the house, the aide's there for 24 hours, 12 hours straight, go home, get some sleep, come back again the next day. The other thing is, if your mom is approved for the NHTD split shift, and the aide is there 8 a.m. to 8 p.m., and there's a hurricane, and the 8 p.m. aide can't get out of her house, there's no transportation, that aide that was there during the day will never, ever leave the house. So 24-hour cases will never, ever be without someone in the house. Ideally, I'm just going to admit somebody, ideally, the aides will go home after 12 hours. But if there's a hurricane or some crazy thing that happens where the aide can't get to the house, your mom will not be left alone, no matter what. We never schedule an aide to work 2 12-hour shifts in a row, because not many human beings can stay awake 24 hours straight. But if there's an emergency, there's never anything to worry about. Your parent will not be left alone. So that's pretty much, you're going to get the case management, which is called service coordination. You're going to get the home health aides. My goal in doing this whole program is so that the family doesn't have to be on the phone scheduling doctor's appointments or transportation or calling a vendor to order chucks. My goal is that the family can just be there to support the family member, but not to actually do the work, I call it the administrative work. You don't need to be your mom's secretary. We need to be a secretary if that's what she needs. Again, I'm going to stop if anyone wants to ask me any questions. Okay.
Hi there.
Angela. Yeah, hi. Angela has a question, I see. Yeah, hi. And Angela?
Yes.
Can you hear me, Madge? Yeah, hi. Madge, I'm gonna answer that question, okay?
Okay.
In the sidebar, you have a client. Angela, you're with a home care agency, or?
I'm a social worker at a naturally occurring retirement community.
At a what?
A naturally occurring retirement community.
Oh, okay. So they're currently getting 24 hours private pay, right?
Yes.
Wow. So the family members, so yeah. Ed, you want to jump in? They applied for immediate needs Medicaid.
Yes, so immediate need Medicaid was supposed to kind of solve this problem of, it taking a long time to enroll it into an MLTC, and was supposed to get family member services right away. But of course it has its flaws like any other program. And Angela, posted in the chat about some of these issues. So yeah, like any other program, it's overwhelmed and it gets inundated with requests. So it can be slow. Sometimes it is a little bit quicker to apply for immediate need. I find that they're a little stricter actually with the Medicaid application itself. So sometimes we're trying to save the client time and get them services faster. But because of the extra scrutiny that those applications get, it ends up taking longer. So it's not a perfect solution. If the Medicaid is already approved, then I would say that they can simultaneously try to start the enrollment process into MLTC to see if they can get services under that. They can still make the March 1st cutoff. Rene, you'll correct me if I'm wrong about this, but I believe prior to enrolling in NHTD, they first have to try to get the services that they need through MLTC, and then if the
Yeah.
MLTC doesn't give enough hours, then they can go the NHTD route. So to answer your
Right.
question, Angela, you can't. I don't think the client can go straight to NHTD. I think first they have to try to enroll in MLTC, show that the MLTC is not providing enough hours, and then they can transition to NHTD.
But
Um,
so just to
un-
follow up on that, could they, if she does an assessment with an MLTC and then, you know, they only offer 8 hours and she declines to enroll, can she then go to NHTD, or she has to enroll in
No.
an MLTC first?
So she's considered, this is considered to be she lives in the community, right? This is not a rehab. I'm not familiar with this.
No, she lives in the community.
Right. So if she were in a rehab or nursing home, we can take them with straight Medicaid, okay? But if she's in the community, the regional office there's a very specific question on my application. It's called alternatives considered. So the alternative needs to be that they could not get their needs met by an MLTC. Does that make sense?
Yeah, so I guess I've helped other clients with this, and I had a client who had their Medicaid processed through immediate needs, and when CASA referred them to a home care agency, I spoke to someone at the home care agency who asked if we were interested in enrolling in the NHTD program. And it wasn't right for this specific client.
Right.
So I wondered if it were possible, if she gets the hours through CASA and goes to the same agency, if then she could, without enrolling into an MLTC, just having the hours through CASA, if she could then
Right.
enroll with NHTD.
Right. So that's a very good question. So my experience has been with when they have through the immediate needs, you're saying?
Yes.
Right. So my experience has been, and again, Ed, what are you seeing? With immediate needs, I'm seeing most people are getting initially for at least 90 days. They are getting sometimes 24 hours. Is that what you're
Yeah,
seeing also?
yeah.
Right.
Immediate need, when they provide, they usually get a nice number of hours. Absolutely, yeah.
Right. So
But
Angela, the
that's
problem
only
that
meant to be short term. That's meant to be a stopgap until the client can enroll in MLTC. That's not meant to be a long term solution.
so if you would have asked me this question even a year ago, the answer would have been different. But now we're coming across a problem where the RRDC is seeing no problem. They're seeing, CASA, they're seeing straight Medicaid, right, at least for the first 90 days. But when they see the high hours, and I used to be able to have a conversation with them and tell them, look, they're getting the high hours, but it's going to end because CASA is not going to keep them forever, at the high hours. So now the regional office is telling me, well, come back to us when she doesn't have the 24 hours anymore. So like we used to be able to use the current situation of being with CASA, of receiving high hours. We used to be able to jump in and do NHTD at that point. However, now they're shutting it down and they're saying, well, what do you want from us? Today she has high hours. Today she's getting 24 hours of home care. So, and they're throwing back the applications. This has been my experience lately. They're throwing back the application saying, you come back to us when she needs us. And it's not enough for me to say, well, she's going to need you any day because CASA is not going to keep this going forever. So they're basically treating that as, well, she has what she needs. So what are you applying for NHTD? Even though I know and they know that those 24 hours are not going to last forever.
Mm-hmm.
Does that make sense?
Yes, it does. Yeah.
Yeah, a few years ago, I had no problem. And I think that they're coming down on everybody because they're so overwhelmed with the amount of referrals. So I'm hearing now that whereas people, family members, social workers used to, make the referrals to the regional office for NHTD, well, we're hearing a lot lately that, who else is making the referrals for NHTD? The MLTCs themselves.
Hmm.
So the RDC is bombarded with referrals. I mean, here's what I would suggest. I would suggest we try. If they're getting their hours through, CASA, and even though we know it's not going to last forever, I would say we can try. but my experience they haven't been open to these applications for a while now. I'm willing to try. I just want to, you reminded me of something else. If you have somebody who has a live-in, okay, that means they have the aide 24 hours a day, but the aide's allowed to sleep. She has a right to sleep uninterrupted during the night. It's been very tricky. Same thing about a year ago. If you would have asked me this question, it would be no problem. We could apply for NHTD and we can get the case split into, a lot of people come to NHTD because they want that split shift to 12 hours where the aides don't sleep. The regional office is being very, very, very picky now. When they see that the person has 24 hours living, they're like, same thing, like, why are you coming to us? They have what they need. 24 hours is 24 hours. There's not 25 hours in the day. I have had people get approved that way, but I have to really build a very, very strong case for supervision and why that live-in aid isn't working. It's not enough for me to tell the regional office, well, the live-in aid sleeps at night and the patient needs to be, moved during the night, she has to be returned. That used to be good enough, but now they're like, excuse me, it's not good enough. So with the live-in aids, with the cases that have a live-in approved, I'm not saying they won't approve them for NHTD, but the burden is really on us to build a very strong case for supervision. That's the magic word, supervision. So if it's just that the family feels that the patient needs to be, moved every 2 hours, that's not enough. But if I'm aware of the fact that this member is trying to climb out of bed at night, is falling, the aide is fast asleep because by law she's allowed to be sleeping, I can do an application for someone like that. One more thing I wanted to, pardon? I have to let somebody in. Hold on a second. Okay, I wanted to mention one more thing. When we talk about the criteria for being approved for NHTD, right? Of course, we're talking about someone who has memory issues. Maybe they have Parkinson's with memory issues that are associated. Maybe they have dementia, formal diagnosis. Maybe they just have age-related memory issues. The RDC is not going to accept somebody who's bedbound. And if you think about it, it makes sense because if the whole purpose of NHTD is for oversight and supervision, so if they're bedbound, where are they going? They're not getting out of bed to try to turn the oven on. They're not sneaking out of the door in the middle of the night and wandering out. What kind of supervision does somebody that's bedbound really need? That's the magic word, by the way, supervision. That being said, I have gotten I've had patients approved for the NHTD program if they're bedbound, but there has to be some kind of history there that even though they're bedbound, maybe they need the supervision because maybe they don't realize their own limitations and they've tried to get out of bed and the family member has cameras in the house and has seen their mother falling in the middle of the night. So if they have a live-in, it's not a definite no, but it's a challenge for us. If they're bedbound, it's not a definite no that they won't get approved for NHTD, but it's a challenge for us. And when I say challenge, I mean for me doing the application, I have to build a very, very strong case for supervision. And the way I do that is with a doctor's letter, my nurse's assessment, a nurse that works with us, the family gives us a history, gives us examples. With the bedbound patient, we have cameras in the house and we see mom trying to get out of bed at night. So the live-in, the bedbound, it's not a definite no, but again, there has to be a real strong need where I can justify the supervision to the RRDC. If it was up to me, I would approve everybody's mother, father. But again, it has to go through the regional office, and they're strict because they're overwhelmed. If you want to refer your mom or your dad to the program, I would encourage you. Meg's going to give you our numbers. Before you make the referral, I would suggest call me. We'll have a little chit chat, a quick, I always tell people when you have that intake, it's very simple. What do I tell them? The daughters and sons, what do I tell them? What do I tell them? I'm like, tell them the truth. It's very simple. But if you want to have a chat with me before you call the RDC, absolutely. Medj will give you my cell phone and Ed's number, and we're always available. And if you just want to call and pick my brain, by all means, pick my brain. You can call me. And if you choose not to go with attending home care, you can still pick my brain. Okay,
Excuse
Medj,
me.
do you want to take questions? Yeah.
Yeah. Can you speak again to, I mean, I'm trying to follow all this, the step-by-step process here. And so I'm just wondering, so, you know, first there has to be active Medicaid, which there is, and then it has to be, the MLTC has to deny, which has happened. Then you have to show cognitive decline. And then I have, so the doctor's letter, does that go to the RRDC?
No, what happens is that's going to be something that we include in the application package. The application is called ISP, Initial Service Plan. When we submit the application to the regional office, you know, to get approved for your parent, they're going to want to see a denial letter that you tried to get what you can get from the MLTC, okay? And then they're also going to ask me for a justification letter. The doctor's letter pretty much will just say, I've been treating this patient for X amount of time. She's being treated for high blood pressure, high cholesterol, but mostly there has to be, even if it's one line from the doctor just saying that, you know, the patient presents with memory issues or dementia or Alzheimer's, or just doctors sometimes will write age-related cognitive impairment. Now, some of you may have had the experience where you have a doctor's letter and the doctor will write an extra sentence, you know, she needs 24 hours of home care. And I don't know if anyone has experienced that, but that letter, when you give it to the MLTC, is not worth the paper it's written on. MLTCs get doctor's letters all the time. They're not really putting a lot of value on that because their function is not to provide that oversight and supervision. There's that word again. So the doctor's letter is not really going to be very helpful with an MLTC. For my purposes, with the NHTD application, it speaks volumes. And I will want a doctor's letter. It just adds a little bit of extra justification for why we're applying for NHTD. So the MLTC denial letter is important because what I said before, there's a question in the application that's called alternatives considered. And one of the alternatives is we tried, we called the MLTC, we begged, we pleaded, they're not giving us what we need. So the MLTC denial letter is something that we need, and the doctor's letter is something that we like to have. Does that answer your question?
Yes, thank you. Thank you.
Yeah. And don't torture yourself. You don't need this overnight. I'm just telling you, if you're already getting services to an MLTC, it's not too soon to start asking.
I mean, we
more
did already
questions?
ask. We already asked for more time, and that was denied.
Did they give you something in writing?
Yes, I believe so. My brother, I think, got something from them.
Now, in the meanwhile, it doesn't hurt to try to get more hours for the purpose of you might be lucky and get an hour or two more. Why not? But it serves a double purpose for why I ask you to call the MLTCs if you haven't yet. Now, for anyone that's on here that's not with an MLTC, there are all these little things. You can try to get a little respite through PSS. You can try to get something called a CHA. If your mother has had a hospitalization or something, we can help you get a CHA. CHA stands for Certified Home Health Agency, and we approve that also. But that as well is not going to be for very many hours or for much, for a long time. These are all little things that I hope that, we can help you just to hold you over as a caregiver. But yeah, they're not long-term solutions.
Okay, so I have placed Renee's and Ed information in the chat box, so you can look in there if you would like to contact them one-on-one. Do we have any additional questions on MLTC or the NHTD diversion program? Okay. Renee,
All
I'm
right,
not
so
sure.
anyone that's thinking of applying for their parent, definitely give me a call before you do.
Oh, wait, I do have one question. This is about undocumented immigrants. How do they qualify if they qualify for long-term care Medicaid?
Well, that would be
Okay,
Ed's department.
yeah, so that's a great question. We're still trying to sort it out a little bit, but as of January 1st, 2024, undocumented immigrants that are qualify otherwise, they're over the age of 65, they're disabled, age, or blind, they can qualify for full Medicaid. They can enroll in MLTC, and they're entitled to the same services that a citizen or a permanent resident or anyone else is. So we can assist them with applying, and theoretically, they should be entitled to the same services as everyone else. That's
Do they
a
have to
new change.
prove where they're living? Do they have to prove, like, what if they're living with a family member and they don't have their own
Yeah,
place?
yeah. There's still some. We still have to submit a Medicaid application. Their income still has to be within the allowable. Their assets still have to be within the allowable. They have to show that they're a resident of New York State. So yeah, there's still some documentation required, but they don't have to, show that they're a citizen or a permanent resident, etc.
Thank you, Ed. Do we have any additional questions?
Oh, Blanca, right? Hi, Blanca. Yeah, we do all the programs. We're also licensed in Westchester, Lower Hudson, Rockland. Um, we we have aides in all the boroughs. If you were to call me today, and I'm overly transparent, I never like to give people false hope. If you were to call me today about Staten Island today, I might have to say no, but I'll pass you on to someone else who could say yes. This week we might do better. This week we're not very strong in Staten Island yet with the home health aides. Another thing is if you're currently so Blanca, the answer is yes, we do Brooklyn and all the boroughs, but we have an office in Queens, we have an office in the Bronx, we have an office in Rockland, so that we can attract aides in all those other boroughs, so that if someone's mom lives in Bronx, we have a lot of aides, so we have a presence in all the boroughs except for Staten Island. I wanted to mention one more thing. If your parent is currently getting hours through an MLTC and then they're going to be applying for NHTD, you have to keep in mind that not every home care agency is approved for NHTD. So if your parent is getting 6 or 8 hours of home care through agency C, whatever their name is, they may not be an NHTD provider, which means that you will have to switch home care agencies to an NHTD provider. However, if you love the aide and the aide loves you, they'll usually go with you also. So you're not necessarily going to be able to stay with your current home care agency. Okay, you're welcome.
I just want to jump in and say that, a lot of agencies have kind of just discovered the NHTD program and they're all jumping into it. But Renee's been doing this basically since the NHTD program came out. So you want to go with an agency that knows what they're doing, that's been doing it for a while, because like I said, a lot of these agencies just jump into it without really knowing everything that it entails, and you just want to make sure that you vet them properly and that you're going with an agency that actually knows how to administer the program. It's a little more complicated than straight home care, like Renee mentioned.
Yeah.
There's a social worker, the case manager aspect to it as well. So you really want to go with someone. It's a complicated application, so you really want to go with someone that's experienced in these matters.
So thank you, Ed. So you said what I was thinking, but didn't feel okay saying. So thank you very much. So when I make it seem so simple, it's a 50, 60 page application we submitted, and maybe every now and then they'll ask me one question. Hey, Renee, can you justify this a little bit more? I made it seem very simple, but the truth of the matter is, if you go with an agency that's new at this or doesn't quite know what they're doing, that application is not just being submitted, coming back, approved, end of the day, end of the story. There have been applications that I've gotten after the fact that have gone back and forth. Remember, the regional office is the one who's like running this whole program. And, you know, they're under DOH, so those applications have to be everything has to be dotted and crossed and justified is the biggest thing. If you go with an agency that just jumped on board, you could lose a lot of time. The application will go back and forth with the regional office. So I didn't want to say that, but you have a lot of providers that don't quite know how to do a solid application yet.
Correct. Just as a point, whenever one of the home care agencies that I work with say, "Oh, we're trying to get into the NHTD, you know, program, and we're trying to," I say, "Give Rene Lowy a call. She knows everything about it."
And that, thanks, Ed, and that goes along with what I was saying. Even if you don't go with my agency, I'm so passionate about this program. I'll help you get there anyway. I can't do another agency's application, but you know, I'm hearing every day new agencies are applying, and then I'm getting calls sometimes from the agencies. Well, we've been working on this application for 6 months, and there's a reason things don't get approved as quickly with a new agency. Let's just say that. Okay.
All right. I want to say thank you again to both Rene and Ed. I have placed their information in the chat box, so definitely I'll go ahead and place it again.
I don't see my email address in there. I see my phone number, my agency's address, but I don't see my email address in there.
That is fine. I'll go ahead and copy and paste and add your email address. In the meantime, I do want to pass it over to PSS Circle of Care's outreach team with Jaylene. And let me just take the spotlight off of you, Rene.
Thank you, Meg. My name is Jaylene Irizarry. I'm a care consultant at PSS Circle of Care. So we are a caregivers program that offers free supportive services to caregivers who are caring for a loved one who is chronically ill, suffering from memory loss or dementia. And these services include counseling, support groups, educational trainings, supplemental items, respite care, advocacy, and assistance with long-term care planning. If you would like to learn more about our program, you can give us a call at 866-665-1713, or you can visit our website at pssusa.org. Thank you everyone for your time, and I'll be sharing the information in the chat box.
All right, thank you, Jaylene. And you know what? I think when I was trying to send it to everyone, I put it in a private message. So let me just go ahead and reshare your information one more time, Rene. Oh. There you go.
Angela, can I ask you to reach out to me when you have a chance?
All right, I'm screening the chat one more time. All right, again, thank you, Jaylene. Thank you so much, Rene, Ed, all of the participants, the Philip Howard Norrick. Thank you for joining us today for our part 2 of the MLTC and NHTD webinar. Again, thank you. I know it's a lot of information. This is being recorded, so if you would like a copy of it, reach out to me via email, and it'll also be posted on our YouTube page. So thank you, everyone.
Okay, great.
Enjoy the rest of your day.
Thank you,
Thank
Mitch. Thank
you.
you,
Bye,
Jaylene. Thank you,
everybody.
Thank
Rene.
you. Thanks very much.
Have a good day.
Thank you, Midge.